What is febrile neutropenia in lymphoma treatment? Imagine feeling perfectly fine one moment and then suddenly developing a fever that just won't go away. If you're undergoing treatment for lymphoma, especially chemotherapy, this could be a sign of febrile neutropenia, a serious condition that needs quick attention. During lymphoma treatment, chemotherapy often suppresses the bone marrow, which is responsible for making new blood cells. Among these are neutrophils, a type of white blood cell that plays a key role in fighting infections. When neutrophil levels drop significantly, we call this neutropenia. If a person with neutropenia develops a fever above 30.0 degrees Celsius, it is considered febrile neutropenia. This combination is a medical emergency because the immune system is weakened, making infections more likely and potentially severe. In the context of non-Hodgkin lymphoma treatment, chemotherapy can cause myelosuppression, which is a reduction in bone marrow activity. When a patient with low neutrophil counts develops a fever, it often signals an underlying infection that the body cannot fight effectively. Because neutrophils are crucial for combating bacteria and fungi, their absence leaves the body vulnerable. Recognizing febrile neutropenia early is essential to prevent complications like sepsis, which is a dangerous, widespread infection, or septic shock, which can be life-threatening. Diagnosis involves checking the patient's temperature to confirm fever and performing blood tests to measure the absolute neutrophil count. An ANC below 500 cells per microliter indicates severe neutropenia. Additional tests, such as blood cultures, help identify the source of infection, whether it's bacteria, fungi, or other pathogens. Healthcare providers also look for signs of infection in other parts of the body, like the skin, lungs, or urinary tract. Management of febrile neutropenia depends on how risky the patient is. High-risk patients, such as those with prolonged neutropenia or other health issues, usually need to be hospitalized immediately. They receive intravenous broad-spectrum antibiotics within the first hour of diagnosis. Common antibiotics include medications like cefepime, carbapenems, or piperacillin-tazobactam, which target a wide range of bacteria. For low-risk patients who are stable and expected to recover quickly, doctors might prescribe oral antibiotics like ciprofloxacin combined with amoxicillin and clavulanate. These patients can sometimes be treated at home with close monitoring. Treatment continues until the patient no longer has a fever for at least 48 hours, feels stable, and their neutrophil count recovers above 500 cells per microliter. If the fever persists beyond 4 to 6 days despite antibiotics, doctors may consider adding antifungal medications to the treatment plan. Because febrile neutropenia can escalate rapidly into a life-threatening infection, it is considered an oncologic emergency. Patients and healthcare teams must stay alert for symptoms like fever, chills, or signs of infection during periods of low neutrophil counts and seek immediate medical care. In summary, febrile neutropenia during non-Hodgkin lymphoma treatment is a serious condition where a fever occurs alongside dangerously low neutrophil levels caused by chemotherapy. It demands urgent medical attention and prompt use of antibiotics to prevent severe infections and complications. Always remember, if you or someone you know is undergoing lymphoma treatment and develops a fever, seeking immediate medical care is crucial to ensure safety and effective management. For personalized advice, always consult healthcare professionals familiar with the specific case.